What I'm presenting at ASH this year is data on dose modification of Talquetamab. So Talquetamab is a first-in-class GPRC bispecific antibody that's approved for myeloma patients who've had at least 4 or more lines of prior therapy, including triple-class exposure to PI, IMiD, and CD38. So we know the drug is very active, response rate of around 70%, and at the every 2-week dosing of 0.8 milligrams per kilogram, the PFS is a very impressive 14 months. Even in high risk and standard risk, they do comparably well, and very few infectious deaths and complications. And so that's a little bit about the background in terms of the efficacy, but the other part of the equation is the safety. So GPRC5D treatment with a bispecific does elicit some on-target off-tumor effects, and those include taste or dysgeusia, skin rashes, palm or plantar peeling, and nail changes. And those range from 40 to 70%. And so one of the questions is, now that we know this is such an active drug with deep and durable responses, can we back off on the dosing schedule at all to mitigate those adverse events? So what we found in the results, we looked at 2 different groups of patients. One were those patients who actually had dose reductions as part of their routine care, and that was about 50 patients, and we found that they didn't seem to have any compromise in their efficacy. So then we validated that in a prospective cohort of 19 patients, about half of whom had a reduction in the dose, and the other half had a reduction in the schedule, so going from every 2-week dosing to monthly. And what we found again was that no compromise of efficacy in terms of response and PFS or duration of response, and a hint that some of those adverse events were improving with the dose reduction. And importantly, we also found as part of this investigation that patients who have these adverse events in the first 3 months have a 20% higher chance of actually responding to the drug, which is really unique because in myeloma, we don't have any other drugs where the adverse events actually correlate with the response. So this is a unique finding. And I think we're really excited to share this data. I think the take-home message here is that Talquetamab is an active agent with some unique on-target off-tumor effects that can be mitigated by backing off on the dose intensity. So it's a great opportunity for patients to have access to this therapy, and I think community docs can be giving it in their home institutions.